In 2018, 49 persons were diagnosed with leprosy. In 2019, the figure dropped significantly to 27. However, the Ministry of Public Health officials have expressed hope that the incidence will decrease even further. Health officials are adamant that this can be achieved if more persons experiencing the signs and symptoms of the disease visit the General Dermatology Clinic located in the Palms Geriatric Home compound to access the free treatment and care. Director of the government's Leprosy Control Program, Dr. Heather Morris-Wilson, reiterated that leprosy is curable.
So it's not something that you stand next to a person that has leprosy, you will get it. No, it's a prolonged many years and months. So most of the times you find that you may pass it on if you have it in your families, because that is where you spend most of your time. So like last year we had 27 cases, new cases, and the year prior, 2018, we had 49 cases.
These remarks were made at a leprosy awareness activity at the Saybrook Market Square on Tuesday morning. The event was aimed at providing education and raising awareness about leprosy. On-site testing for the skin disease and other skin-related illnesses was available at the location. According to the doctor's observation, leprosy patients and their families often face serious discrimination and isolation. She debunked claims that the disease can be spread by coming into contact with a leprosy patient once.
A leprosy patient is not the only person who would be shunned, but their families in some way indirectly would be affected. Say, for example, a community may know that this house has a leprosy patient, and hence the whole family members would be shunned. So they will say, do not marry into this family because they have it, right? So we don't want our population to go on thinking that leprosy is, it's dangerous. It is not.
Dr. Morris-Wilson revealed that now more than ever, children are contracting the disease locally. She urged adults to get the medical help needed as soon as possible to avoid passing the disease to their charges. Monthly health checks are conducted with leprosy patients in regions 3, 4, 5, and 6. The other outlying regions benefit from the initiative at least once annually. Here is Medical Officer at the Leprosy Control Program, Dr. Lauren Caton, explaining some of the first symptoms of the disease.
Areas can be without hair. You can have hair growing on the other areas of your skin, but that area could be without hair. Also, you could have sweating occurring on your body, and that area would be without any sweat. It would be dry. Sometimes it's numb, so you wouldn't feel there. If you touch, it might be numb or it might be less sensitive.
According to the World Health Organization, leprosy, which is also known as Hansen's disease, is a chronic infectious disease caused by Mycobacterium leprae. The disease mainly affects the skin, peripheral nerves, and mucosal surfaces of the upper respiratory tract, and the eyes, and in severe cases can cause disfigurement and deformities. Leprosy is known to occur at all ages, ranging from early infancy to very old age. For the HGP Nightly News, I'm Mel Griffith.